Good morning, everyone. Such a pleasure to be here today. I'm Mohamed Sheta, the co-founder and CEO of AiZtech Labs. We are a deep tech company in the preventive cardiology space. And today we will be talking about the iSelfie, your AI companion for everyday personalized health. For decades, access to care was all about a symptom or a signal, or what we call an ouch. You feel sick, go to the doctor. You feel super sick, go to the emergency room. And as this system has grown and overgrown and outgrown, we cannot keep pace with the demand. So what is the solution? Should we build more emergency rooms, or should we ask why people are getting care only at the emergency room? Today, humanity is at a different tipping point. We do not behave as we used to be decades ago. We transact our lives on our phones. Anywhere, anytime is our definition of convenience. Not only that, most of us are now taking active and even sometimes proactive ownership of our health. This is whom we call Generation Now. Those are the majority of our workforce, more than 57% of the workforce. And their now is what is driving the economy and the whole society. So the current model of access to care cannot be those of the past. We really need to think of new models of care. The iSelfie, your AI companion for everyday personalized health. We are in the business of saving lives and livelihoods from secret killers. And the first secret killer we'll talk about is the #1 secret killer in the world, hypertension. We all know about it, but perhaps not feel what it can do. Only today, 50,000 people will be dying from hypertension-related cardiovascular mortality. In fact, there is 1.5 billion people diagnosed already with hypertension worldwide. But let's look at the US numbers because they are really staggering. 120 million people are diagnosed with hypertension in the US already. Out of them, 93 are out of control. What was even mind-blowing to me is those at the age of 18 to 44, their prime productive years, 28 million of them are out of control. A majority of them have decided not to take the medication. So their only way is to take lifestyle changes, or what we can call hand-holding every day. And this is where the iSelfie can be of great help. The iSelfie is your AI companion that can detect, protect, and prevent cardiovascular-related risk factors. With just a selfie experience, the iSelfie can help you measure your blood pressure, heart rate variability, blood oxygenation from just a selfie experience. And I promise I'm not smoking anything. It is real. And you can even try it yourself. Not only hypertension is the first priority use case we're focusing on, but we're also focusing on another secret killer, COVID. And I'm sorry, I'll be bringing some inconvenient truth in the coming slides. Why should we really care about a virus if 95% of people who contract the virus survive? At the start of the pandemic, the biggest issue was, would you survive the virus? Can you really pass? But latest research is showing us the story is absolutely different. We should be more worried about those who survive more than ever. Because one in every 4 people who survive an active infection of COVID-19, they get what's called long COVID. What is long COVID? Look at this. It's a multi-system end organ damage due to a disruptive inflammatory continuous process that can lead to continuous fatigue, memory loss, brain fog, dementia, and others. Today, as we speak, 30 million people already are disabled due to mental or physical impact of COVID-19 only in the US. And guess what? Every time you get a reinfection of COVID-19, your risk of contracting long COVID goes to 2x. In fact, if you look at this, the risk of long COVID impacts is going exponentially up as the reinfections happen. So what's the solution? Make sure that you're in a COVID-safe environment. Protect yourself, because if you are safe, we are safe. If every one of us is safe, our families are safe, and the whole society would be going forward. Out of those 30 million people who are mentally and physically disabled, 20 million are in the age of 20 to 40. The iSelfie can help in detection of active infection of COVID-19. With only 4 selfie images, you can get to know if you have an active infection of COVID-19 or not in just 5 seconds. And this time, if you are asking me, what are you smoking? I will say, science, future-grade science. This is based on a breakthrough research done on the ocular biomarkers. We discovered that the virus exerts signature manifestations by changing the topography of the outer surface of the eye. And those topography changes can be detectable by a sophisticated AI system. We have built a state-of-the-art frontier AI system that takes 4 selfie images, isolates the outer surface of the eye imaging, then passes them through layers of prediction through a sophisticated convolutional neural networks that ultimately will give you back the results in 5 seconds. Clinical validation studies are already completed. We have done studies in Canada and the US across 14 clinical research sites, including university-affiliated sites. If you see some gray hair, this is because of IRB nightmares we've been going through. We built a proprietary data set of more than 50,000 eye images, and the performance of the iSelfie today is comparable to an antigen-level performance. The negative predictive value is more than 90%. So if the iSelfie says you are negative, the probability this is a true negative is more than 90%. We did not stop at the COVID. We're also exploring other emerging pathogens like flu A, flu B, and RSV. The first step was a recent study where the iSelfie was run on 625 people who visited the emergency room with symptoms. And as you know, with JN.1, the symptoms of COVID-19 now are more like flu, right? You ask people, they will tell you, you know what, I got this flu thingy, right? So those people who got the symptoms, the iSelfie managed to classify most of them as true negative. And when they have done their multiplex PCR, the results came that they are COVID negative, but in the same time, they are flu A positive, or flu B positive, or RSV positive, which means that it could even differentiate between the topography changes, the signature manifestations of COVID-19, versus other respiratory pathogens. And we are continuing to explore that further. We are crazy enough to believe that we are in a mission to impact 1 billion lives. We are a team of mission-driven people with solid experience in deep tech, AI, computer vision, clinical research, innovation, and commercialization. We're also privileged to be advised by some of the world-class advisory boards from Mayo Clinic, University of Miami, University of Toronto, Google Health, and even privacy and data protection. Save a life. Join our mission today. Take an iSelfie and make sure that you're safe, because if you are safe, we are safe. Thank you.